Hello, everyone. Welcome to today's Tech Talk. It's our first one back for 2026. So February, yes, but Happy New Year from Tech Talkers. We're back again with the latest digital transformation developments for the aged care sector. I'm Janine Bennett, Assistant Secretary and Engagement Lead for the Department's Digital Transformation Program, and I'm your moderator for today's webinar. It's great to be back with you, and thank you all so much for your continuing interest in our program. Today, I'm joining you from Canberra on the lands of the Ngunnawal and the Ngambri people. So I'd like to acknowledge the traditional custodians of this land and pay my respects to elders past, present and emerging, and to also extend that respect to any Aboriginal and Torres Strait Islander people joining us today. It is lovely to have you with us. A few quick housekeeping notes. If you have any connection issues during the session, there are dial-in details on screen. They're also available in your meeting invite, so feel free to jump back in using those details if you have any problems. As usual, today's webinar is recorded. We'll be uploading the recording to our website so you can watch the session again, or you can share it with somebody who wasn't able to join us today. You can also watch any of our previous Tech Talk webinars from our website or from YouTube. So if you've got a spare day or two, there's around 72 hours of exciting Tech Talk viewing available online. We encourage you to check that out. Just search for Digital Transformation Tech Talk webinars and you should find it. The links for the QR codes that we show during today's session have already been posted in the meeting chat, so feel free to take a copy of that. Anything that's of interest to you, you can just click on those links. Alternatively, you can use the QR codes on screen throughout the sessions. We'll also email those links to you after the event. So one way or another, you're definitely going to have access to the resources we share. Be aware that the chat function is now turned off though. That's so we can gather all of your questions in the Q&A tab. Speaking of Q&A, we have about 30 minutes at the end of today's webinar set aside that is strictly for discussion. So you'll find the Q&A tab at the top of your Teams window. Ask your questions in that tab at any time throughout today's webinar, and we'll make sure and queue them up for the Q&A session. Remember to use the vote up if you see other questions that catch your interest. As always, if we get more questions than we have time to answer, we'll take them on notice. For any highly specific or detailed questions that are related to your particular individual circumstance, we do encourage you to either include your name so the team can contact you and work to get an answer, or if you prefer, you can email us directly, and the address should be on screen now for that. If we don't get your questions in session, please know you're not being ignored. We'll either come back to you individually or pick up the topic at a future webinar. For regulars, you'll know that we often bring our popular questions back to future agendas. And we also use those questions to help plan out our future Tech Talks. So we're definitely paying attention to what you're asking and what you're interested in. Keep in mind that our focus here at Tech Talk is on technology and delivery work. When needed, we do reach out to our policy colleagues and they're very generous in sharing information, but generally speaking, we like to focus on those areas if we can. There are other forums and webinars available that focus on the policy detail. And just a quick note for our media representatives in the room today. First of all, welcome. We really appreciate your continued interest in the information we do in the department. If you do have media related questions though, please do direct those to our media and events team. You can reach them at news@health.gov.au and they're in a really good place to help you with those media related questions. Okay, here at Tech Talk, we do put in every effort to ensure that the information we provide to you is accurate, relevant and informative, but please keep in mind that it shouldn't be taken as specific advice or as government commitments. We talk about this a bit. We know those formal announcements from government happen elsewhere. The information we include at our Tech Talks is to cover areas of mutual interest and talk about our common experiences and collectively mature our digital operations across the sector as we go about identifying and tackling those common challenges. But it's up to each organisation to exercise their own skill and judgment and research about what is needed in their individual cases and how you apply the information we provide. So just carefully consider your local suitability for anything that we're sharing with you. Okay, now onto the agenda. First up today, we have Faye Flavaris here to take us through the digital transformation update, including our roadmap. And then Faye will continue on to talk about AI, a very popular subject with our audience. So we're really looking forward to that one. Then we have a Tech Talk newcomer, Matt Newman, who's here to give us some insights and hints on cybersecurity, highly relevant subject area for all of us in the digital sector. And then I'll do a short piece on digital future before we get to the Q&A. We also have an exciting special guest today, which I'll let Faye introduce. Excellent. Okay, so I'll start by handing over to Faye, who is our Chief Digital Information Officer at the Department of Health, Disability and Aging. She's responsible for driving the department's digital transformation agenda in aged care and well beyond. Faye, welcome, and over to you.
Thank you, Janine, and hello everyone, and welcome back to 2026. This is our first digital transformation tech talk for the series for this year. I hope everyone had a bit of a chance to rest and recoup over the holiday period, because yes, we've come back in. I can't believe it's February already, but it's definitely nice to be back and be with you guys. So starting off with our digital transformation roadmap, it's here where we try and share, at least where we can, 6 months in advance, some of the work we are all actively looking at in the department. I'll also give my usual disclaimer that it's important to note that the timeline on this roadmap is there to support, in this particular case, the aged care reform and its agenda, and the releases of work and functionality that we're putting out. It should not be considered an official commitment from government. So often we might be working on things a little bit and staging them a little bit different. That is different to when a policy announcement happens. And so that happens elsewhere in the processes outside of Tech Talk. As you have probably heard at these sessions previously, we make a point of sharing this roadmap so early and often so that we can be as transparent as we can. But what that does mean is sometimes changes occur, and where that happens, it is our intent to call that out as much as we can. So you'll notice here for our first 2026 release in February and March, we'll be making a number of changes across our aged care ecosystem. For our GPMS system, you can see there's a focus on the preparation for care minutes, performance-based supplements, which will come into effect in April and will link the amount of funding residential providers receive with the actual care minutes that they're providing. We're also in there allowing providers to self-manage offline beds using the Manage My Organisation tile in the Registered Provider Portal. We're enabling residential aged care providers to preview existing and future finance and operations information through the portal. And also there'll be, we're updating the star rating system to include graded assessments against the strengthened aged care quality standards, with the compliance rating consistent with the requirements of the new Aged Care Act. These graded assessments, regulatory decisions and quality standards outcomes will then be published on the My Aged Care website for our consumers to be able to get access to. On the My Aged Care website, streamlining provider pricing updates against multiple outlets so that providers don't have to re-enter the same information for every outlet in its pricing cycle. So hopefully that reduces some administrative work. We're looking at improvements to the transition process for HCP clients entering support at home. That will include additional information on the support at home letters, such as the AT, HM, high tier cap and remote supplements, automating the management of restorative care pathway caps as well, and the automated notice of decision letters for the CHSP assessments. So lots going on. Looking to the releases scheduled for June, GPMS changes will introduce some DocuSign capabilities for provider operations collection forms, updating some quarterly financial reporting for residential aged care providers. We'll be adding some new data items and removing some of the older ones there. So small tweaks to the existing arrangement. and in addition, adding quality standards, conformance outcomes to the My Aged Care website. So as you can see, we're trying to give you a bit of a heads up as we move forward through the timeline. Also in June for the My Aged Care ecosystem specifically, facilitating the introduction of the support at home pricing caps, enabling providers to enter pricing that aligns with the caps and ensure Services Australia can validate claims against these limits, and strengthening assessment workflows to make updates allowing providers to see clearer decision information for more accurate service planning. We also have an enhanced client communication letters and supporting better data analytics for yourselves. So you'll note the roadmap also shows Services Australia's changes as well. So that's one of the improvements we all worked together on last year, is to get a one government view of all of the changes. We're grateful for Services Australia's contribution. And if you have any question about their release information, the Services Australia representative, we've got one in the wings here. So put the question in the Q&A and see if we might be possible for us to answer that question here today. We're also working with the Commission to have their release information added to this for our next Tech Talk, if possible. So we'll keep you posted on that progress as well. So watch this space, and I look forward to your questions in the Q&A. So I also think we've got maybe our first release going a little bit this weekend too. So we have this internal thing of Go Green team, and we're a superstitious bunch. So go green for a positive release, everyone. Now look at some of the new updates on resources. As we mentioned in our webinar in November last year, we're expecting that the pace of resource publication to slow down this year a little bit. There was a bit of a flurry towards the end of last year as we got ready for the 1st of November, but that's kind of behind us. However, we do want to keep you across any new developments or updated resources. So we'll keep bringing them here to bring them to your attention so you don't miss them. And from the Aged Care Quality and Safety Commission, their first bulletin explains what providers need to do to meet their new Support at Home program pricing requirements. The bulletin also describes what actions in the Aged Care Quality and Safety Commission can take if these requirements are not met. And so the guidance for residential aged care provider, the guidance for residential aged care providers outlines some of the regulatory changes affecting them under the new Act. And the last one there is updated guidance for the allied health professionals. So lots of us in the ecosystem with slightly different focuses. So where possible, pick up the information that is relevant to you. To wrap up the resources, I'm pleased to share that this update from the End of Life Directions for Aged Care initiative. We had LDAC present on our Tech Talk in previous sessions about their program and methodology, and the group held LDAC webinar. The group held an LDAC webinar yesterday. I think I need a cup of coffee, folks. I'm a bit tongue-tied this afternoon. And they announced the release of their LDAC digital dashboard. So this dashboard is a Power BI dashboard for anyone who's interested in the tech, provides a real-time visibility into the end-of-life care quality. And the initiative is offering the model to all aged care services who might be interested at no cost to the provider with no contracts or licensing fees. So they can build and implement the dashboard in-house with the support from the LDAC team. And so if your organisation is interested in this dashboard, I encourage you to reach out to the LDAC team. You can do so by through the QR code, or there is an email address on the slides as well on the screen. So, free resource for those who are interested. Now, that kind of concludes our roadmap. Moving on to our next agenda item, which is artificial intelligence. So if you hadn't noticed, it's a bit of a hot topic, unless you've been under a rock. Everyone's talking about it. And so we thought we would bring you some information about it. We've had a lot of requests for information on this subject, as AI is a big topic that's getting bigger all the time. And in the department, we continue to look at ways of adopting the new technology, and we know our partners out in the sector are facing similar challenges. So we'll be focusing on some of this emerging tech this year, including AI in our tech talks, so that we can bring some thought leadership to all of you. So those who don't have time to invest, hopefully we can bring a summarized view to you. So today I just want to cover some of the basics, and I know this will be familiar to many of you, but for those who don't have a resident expert or don't have the ability to go out and, look at some of this stuff, we wanted to bring some of the core concepts specifically in regard to AI. And what you've got here on the screen is the definition of AI as it's from the Organisation of Economic Cooperation and Development, OECD. The definition that also has been adopted by the Australian government. So we've leveraged that. So feel free to read this at your own leisure. But I think we'll have our own thoughts and perspectives on what it is and what it means for us and how we might be able to use it. For me, AI is something that's evolutionary and not instantaneous. There are lots to understand. I talk about it being the tip of the spear for digital. And the risks are real. In some ways, I think AI amplifies the risks that come inherently with a digital solution. So we need to approach the adoption through a very structured and safe experimentation and approach. I think it needs to be iterative in the way we start to learn and adopt it and we need to understand in what context we're using it. No, I don't think it's going to replace us all as humans. I think it's a tool that will augment, especially in the industry we are. But there are, multiple uses for AI that will accelerate the machine approach, especially in devices and other things. So wanted to start off by saying, be strategic. We need the guardrails and the governance. And while it isn't fully integrated yet for many of us, perhaps all of us, it's firmly on the agenda. And so we need to be planning for it. I'm not going to go through all the different types of AI because they're varied and vast, from machine learning to natural language. There's agentic AIs, there's generative AI. So I think definitely if you're interested, get onto that website and it has a definition of all of them. Importantly for us, there's just to recognize there's the AI itself, the model, but there's also the data that AI needs to actually then, become real. And so if your data is not great, you potentially won't get great outcomes. And we definitely need to look at, if the data is flawed or if there's biases that we have inherently built into it, AI will just amplify those. So, it really does need a different way of thinking around how you deliver on solutions. Some examples of common AI applications you can see here. Search engines these days are already using AI to rank results. Social media platforms are already looking at them around your interactions and how they feed you, what you're already looking for. You get autocomplete. I don't know if I like that one. Sometimes I'm typing something and it auto-corrects when I'm not looking. But there's a lot of, individual scenarios that it can be applied for. Closer to home, if I look at aged care as a whole, there are plenty of real use cases that we can be using, like AI robots in residential aged care facilities, who might go and get the food from the kitchen and bring it up to the different wing. We've got AI scribes now in GPs. We've got wearable devices and lots of apps. So I can definitely see more and more of these AI and automation pieces being included into the ecosystem of how we work, not necessarily getting in the way, though, of the human-to-human interaction, but there to assist us. Now, today we're reflecting on a real-world example that we brought to you last year. It's closer to home. We had Uniting Care come and show us their generative AI digital assistant for its staff. I think it's called Buddy, so that's lovely. And it was designed to provide support at the point of care for the aged care community care workers. So last year we had Andrew Dome, who's the Chief Digital Information Officer for Uniting New South Wales and ACT. And I am thrilled to invite Andrew back to the stage with me to give us a bit of a view how it's all going today. So Andrew, welcome and thank you very much for joining us again. I think it's been almost a year, I think, to the date. I think it was February last year. So how's it all going?
Yeah, well, thanks, Faith. Thanks for having me back. And look, it's going really, really well. And I actually did think back, it was around about 12 months ago that we presented into this tech talk. And back then we were actually talking about, what we're building. And now we can actually talk about what we built, what's actually in production and what, our employees are currently using. So it's gone really, really well. It's been very well received by our employees. I'm happy to talk about what we are seeing. But it's really actually removing a lot of administration burden for them, and they're telling us they're getting 1 to 2 hours back in their day to do other things, which is amazing for us because that means better quality aged care for our customers. So yeah, it's going really, really well.
Excellent. So we sprung this on you at short notice, so we'll keep this nice and easy and casual. I guess the first question is I'm just curious, have you guys been formally tracking, you say 1 to 2 hours, but how have you gone with your efficiencies and, administrative, do you kind of measure it, or is it an anecdotal thing?
So a lot of that is actually from our verbatim comments from our employees. 1,000 of our home and community care workers currently have this on their phones, and they go out, and the majority of the administration burden removal is when they come out of seeing a customer in their home, they jump in their car and they do that voice to text transcription service, which typically would take 10, 15, 20 minutes. They would type it up. They may have to travel to a Uniting site to do it. So that negates all of that. And they're telling us, this is actually now just taking us half a minute to a minute. And the other really good thing about, Buddy and the way that we've designed it is it's got that natural language translation service. So it supports 50 different languages. We have a high percentage of our workforce at the front line that are from Nepal, actually, as their original home of all country. And they can actually speak Nepalese. It will convert it into English and then put it into our clinical system in the back end. So a lot of it comes through surveys that we do with our customers. We actually have also started to track, keystrokes on the actual Buddy itself to say, well, what tiles are they actually clicking on most, because that will then surface the content that they obviously are using and therefore the ones that we should be focusing on. So at the moment, a lot of it's from surveys from our employees to say, what are you actually seeing in terms of those time savings? But there are other ways that we can measure that success. Now, remember, we are not-for-profit, so our costs around taking FTE headcount out. That's not us at all. We're very much like T said, Faye of earlier, which is augmenting and reducing administration burden, certainly not replacing people.
Yeah, no, that's awesome. And it's good to hear. So you're grabbing insights from multiple different channels, whether it's the surveying, you're looking at the app itself technically and looking at, a human-centered approach of gathering the insights on the clicks. So you're getting multiple different sources to help inform. So that's awesome. When you kind of rolled it out, in the last year, have you had any sort of key hurdles or resistance from the staff, between originally compared to now that they see it as useful?
Well, I think the org change is obviously crucial for any major rollout for things like this. So we probably over-egged that a little bit. We went really hard on the org change management, took all of our home and community care workers, our employees, through this, got them comfortable with the tool. But I think that the key thing is actually the design. You've got to make sure that when you're rolling out a platform, it's really intuitive and easy to use. Because no one showed you how to use ChatGPT, right? But all of a sudden we were experts and we could put in a question and get a response. So by making it really simple, and as you can see on top of the phone there, these are just tiles which they click. it says on there what that service is or what the content is or what's going to be retrieved. So by making it really easy, the buy-in was good from the start. We did make sure that we had those controls though in place. We did show them how to use the tool, and the uptake's been really, really good. But again, the narrative's been really, really strong. It's about giving them the tools to augment and free up time. It's by no means to look at, replacement at all. So it's a very, very strong narrative we've had since day one.
No, that's great. Now, moving on to some other important considerations, of course, the human element, but now more to around the security and governance. So what was your experience there from an organizational perspective around getting some of that security and governance happening? Especially, it looks like you're giving a device out to them and they're going out and about. So it's not necessarily, it's on a mobile, it's not necessarily locked down on an internal network. What were some of the key considerations that you guys experienced there?
Yes, data and security. You mentioned Faye before, right? AI is all about data. At the end of the day, the data, it supports that, and that retrieves the content or creates the content of your existing data. So we actually did take quite a cautious approach, and we had to make sure that we knew where our data was, what we were trying to access, and we had the access controls in. So this is persona based, which basically means if you have access to that data now, you get access to that data via Buddy. If you don't have access to that data now, you won't get access to it via Buddy. So first of all, through our security program, this is run by our CISO, we made sure that the security controls were in place, and we tested that via system integration testing and then via UAT. So we made sure that security program had those controls in place from the outset. The other really key thing is making sure that on board for this as well. Make sure you have some governance around it. Show them that you've got the controls in place so you get their buy-in. And we got them really, really on board quickly when we started the case, which was policies and procedures, showing them that the controls were in place. They bought into the whole idea, and we kind of moved on from there. But if you don't know where your data is, or you haven't classified your data, make sure you put those security controls are in place first before you go out for a wider sort of deployment for this type of tool.
Excellent. Yep. So loud and clear, you had some really strong security foundations to start with that you then built upon. So yeah. So what's your one biggest lesson that you think you might want to impart to everyone?
Get your execs on board right up early on the journey.
Yes.
Make sure your business is involved as well. I mean, this is not IT by any means going to the business and saying we've got some shiny new tool and it's called AI. Let's go and have a play with it. The start of Buddy was all around going out to our business and saying, well, what are your key business problems you're trying to solve? And we ran a whole bunch of hackathons and discovery workshops. We came up with 50 use cases, narrowed them down to 10, and then we focused on the top 3. And those top 3 became our first generative AI use cases, and they're on Buddy right now. So engage your business, get them involved in terms of the problems that we're solving for them, then overlay the technology, and all the way through that sort of user acceptance testing, bring those business people back into that equation and get them testing the results and provide that feedback loop as well. Because the questions that we were asking the chat side, the generative AI chat side, the IT people were prompting it with certain questions. When we got our business team to come in, the frontline workers, they ask completely different questions because they're at the front line and they actually want to know different things from what IT does. So make sure your business is involved right from the outset all the way through.
I think some very words of wisdom there, like lots of gold nuggets. Thank you very much, Andrew. And I believe you're sticking around so that our community can ask some questions. So thank you. We'll have you back up in a little bit, and we'll move on now to our next agenda item. Thanks, Andrew. Oh, and before we just move on, I do have one bit of a learning bite for you. And these are just some key considerations that we thought we'd put on a page. Yes, a round of applause, yes, for Andrew. He'll be back later for us to have a Q&A. I think one important part as a takeaway for us all is, with AI becoming more common, it's time to think about how everyone looks at it in a safe and responsible way. So many organizations are still trying to work their way through what it means for them in practice. and where can AI genuinely help and where it introduces risks. So when you use AI, it can really help. When we do it well, it can really help support decisions, improve productivity, as you've heard from Andrew's example, help us connect with customers in new ways that potentially we may not have been able to, and free up time so that we can reinvest that into other areas, hopefully reducing, stresses and pressures in the workforce. But that is highly dependent on doing the work to make sure we address the implications for privacy, data use, ethics, and client safety. So often in the department, I talk about AI as a high-spec sports car, and it's powerful, but it's really important that we know how to drive it and before we get behind the wheel. And so digital becomes everyone's business, because I think everyone now has the tools in their hand. There are particular risks in care settings that if staff aren't supported or are aware, can amplify, risks for client and their data. And so it isn't a one-size-fits-all solution. So here are some considerations that we think you might want to ask yourself to help frame your thinking rather than driving straight into a solution. Let's start with some of the simple questions to reflect on your organization's starting position and capability. And what are some of those foundational pieces that you might need to have in place before you start leveraging AI? It's not an exhaustive list by any means. It was just a bit of a teaser and making sure that, before you start implementing, that you've got some clear pathways in place around some of this thinking. So this is not to scare people to stop experimenting, not by any means. I'm really big in moving forward, but it is about making sure that you do it in a thoughtful and considered way so that, if you do experiment, you do actually get great results. So that's all for me from a learning bite. I believe I will now be handing back to Janine and she'll introduce the next topic. Thanks, Janine.
Thanks, Faye. Appreciated. Okay, so now we're going to hand it over to Matt Newman. So Matt is the Assistant Secretary for Cyber and Assurance Branch in the department, and he is a Tech Talk first-timer, so everyone be kind to Matt. He's going to talk us through some cybersecurity considerations that are really useful. And I'm really loving the provocative title of your presentation, Matt. Who let the robots in and what do we do about it? Over to you.
Thanks, Janine.
Who let him in, Matt? Was it you?
Mate, I think it's most people now. We've all got an AI client on our phone and we can interact with it and it can do some weird and wonderful things. And we'll chat about a bit briefly how we secure that in the most basic ways for our organizations, as well as how we can do that personally. So thanks for handing it over to me, Janine. I'm the Chief Information Security Officer for the Department of Health, Disability and Aging, and I know what everyone's thinking. Great, the cyber guy is here to tell us all to stop using the fun new toys. Well, I promise that this isn't that kind of talk. I won't tell you to stop it, I'll tell you how to use it securely. So here's the thing, the robots are already in the building. AI tools are here, they're useful, and frankly, they're not going anywhere. We've got ChatGPT, Copilot, Claude, AI assistants. They're writing our emails, summarizing our reports, and sometimes, well, they're doing things we probably didn't think through. Here's something I want you to think about briefly. Who here has copy-pasted something into an AI tool and then immediately thought, should I have really done that? Well, yeah, me too. I've done that. We've all been there. The good news is, though, we can have our AI and we can secure it too. We can get the productivity benefits, the time savings, the innovation without accidentally uploading medical records into the AI ether. So today I'm going to share 3 practical strategies that will help you set the foundation to use AI confidently and safely. Think of this as your AI house rules, because we let the robots in and now we need to teach them some manners. So let's talk about what we're feeding these AI tools. AI models are just like teenagers. They'll eat anything you put in front of them, but that doesn't mean that they should. Here's what's happening in the real world. People are uploading full care plans, resident contact details, clinical notes, and even entire spreadsheets with Medicare numbers into public AI tools. And look, I get it. We're all trying to save time. We need a summary. We want to analyze trends. The AI is right there and it's so helpful. But here's the problem. Once that data goes in, you don't control where it goes next. Some AI tools use your inputs to train their models. Some store it on overseas servers. Some, we honestly don't know what they do with it. And there's the risk. So here's strategy one. Put your data on a diet. So first, create a do not paste list. This is your organization's version of don't eat that, it's off. So what should be on the list? Anything with personal identifiers, names, addresses, Medicare numbers, dates of birth, clinical information like care plans, medical histories, medical lists, anything marked sensitive or confidential, and login credentials. Yes, I've seen this happen. So think of it this way. If you wouldn't post it on a community notice board at the local shops, don't paste it into an AI tool. Second, use approved tools for approved work. Not all AI tools are created equal. Some are designed for enterprise use with proper security controls and Australian data residency. Others, well, they're great for writing birthday poems, but less great for aged care administration. Your IT teams can help you identify which tools are safe for which jobs. If you're summarizing public information or drafting a newsletter, fine, use whatever works. If you're analyzing sensitive data, you need organizationally approved and secure tools. And third, mark your AI output like a food label. You know those labels that say may contain nuts, made in a facility that processes dairy? Do that for AI content. When you generate something with AI, add a simple note or status that reads something like AI generated summary verified by Joe Blogs on the 19th of February 2026, or source data, publicly available reports, or requires human review before use. This creates a bit of accountability and helps the next person understand what they're working with. So your call to action for strategy one is sit down with your teams, even if it's just for 15 minutes, and create your do not paste list. Write it down, stick it on the wall, make it as normal as the fire evacuation plan, because right now we're in a learning by accidents phase, and I think we can do better than that. All right, let's talk about locks. We need to lock the doors on AI, but we shouldn't lock out the innovation. So when we bring AI tools into our organizations, we're essentially installing new doors into our buildings. Don't get me wrong, they're smart doors. They're really helpful doors. And these doors can write reports and answer questions, but they're still doors and doors need to be locked. I know intimately how much security can feel like friction in a business. You've got multi-factor authentication, access controls, password policies. It's all a bit annoying when you just want to get the important work done. But here's the thing, the bad guys aren't annoyed by our weak security. They're absolutely delighted by it. And with AI in the mix, the stakes are much higher. If someone gets into AI tools, they're not just reading your emails. They might be accessing every document you've ever fed into that system, every question you've asked, every summary you've generated. That's a lot of information in one place. So here's strategy two. Lock the doors, but don't lock the people out of the good stuff. Here are 3 simple steps to lock those doors. First, turn on strong sign-in protection. Multi-factor authentication, or MFA, is non-negotiable. I know it's an extra step. I know it's annoying when you're on your phone, but it works. If someone steals your password, they still can't get in without that second factor. Think of it as a double lock on your house. Sure, it takes an extra second to turn both locks, but when you're securing sensitive and important information, it's worth it. Second, give people the minimum access they need. This is called least privilege in the cyber world, But really, it's just common sense. Not everyone needs access to everything. If someone's job is to write newsletters, they don't need access to clinical systems. If someone handles administration, they don't need access to infrastructure controls. Tailor the access to the role. This isn't about trust at all. It's about reducing risk in an organization and personally. If an account gets compromised or someone clicks a dodgy link, the damage is limited to what that account can access. It's like not giving keys for the entire building to the person who just needs to use the meeting room. Third, keep a basic activity trail. This is just logging. Who accessed what and when? You don't need NSA level surveillance, but you should be able to answer some basic questions like, who uploaded that file to the AI tool? Or when was this document last accessed? Or maybe, did anyone export a large amount of data yesterday into that AI tool? Good logging helps you spot problems early and helps you investigate if something goes wrong. Plus, when people know that there's logging happening, they tend to be a little bit more careful. So your call to action for strategy 2 is, if you haven't already done it, turn on multi-factor authentication for your critical systems. Do it today, right after this talk. And if you don't know how, grab your IT team and make it happen. It's the single most effective thing that you can do to protect your organization. So here's a bit of a dangerous phrase, set and forget. We love the idea, right? Set up the system, walk away, let it run forever, like a slow cooker or a well-behaved houseplant. But the problem is that AI isn't a houseplant. It's more like a puppy, a very smart, very energetic puppy that needs regular check-ins and knows where the treats are. So here's what happens when we set and forget that puppy. The AI tool you set up 6 months ago has changed its terms of service. The integration you built is now sharing data with a third party. The model you're using has been updated and is giving different answers now, and nobody noticed because nobody was actually looking. I call this set and regret. So here are the principles for strategy 3 to help you prevent that regret. First, keep a simple AI inventory. You can't manage what you don't know exists, so make a list. What AI tools are we using? What are we using them for? And who has access? Where's the data stored? This doesn't need to be a 50-page document. A simple spreadsheet is fine. Update it when things change and review it regularly. Think of it as knowing what's in your fridge so you don't accidentally serve last month's leftovers. Secondly, do a monthly quick check. I'm not talking about a full audit, just a quick review. Are people still using these different AI tools appropriately? Have any new tools popped up in the environment? Hopefully they haven't. Are there any weird patterns in the logs? Has anything changed with the vendor? Just takes 15 minutes a month. That's it. Less time than your weekly team meeting and way more valuable than pretending everything's fine until something breaks. Thirdly, verify, verify, verify. This is the really big one. AI is confident, scarily confident. It will give you answers with complete certainty, even when it's completely wrong. We call these hallucinations. So here's the rule. Never trust AI output without human verification, especially when it matters. If the AI writes a care plan, a human reviews it. If it analyzes data, a human checks the logic. If it drafts a response to a family member, a human reads it before it goes out. AI is a brilliant assistant. I don't think any of us are denying that. It's not a replacement for human judgment though, or human empathy or human accountability. When we're working with people's health, their safety and their dignity, that requires a human in the loop, always. So your call to action for strategy 3 is start your AI inventory. Open a spreadsheet, Write down what you know, ask your teams what they're using, get it documented. Because you can't protect what you don't know about, and you can't improve what you haven't measured. So we let the robots in, and you know what? That's totally fine. AI is powerful, it's transformative. It can help us work smarter, provide better care, and free up time for the things that actually need human attention. But only if we use it responsibly. So put your AI on a data diet. Don't feed AI everything. Be selective, be smart, and label your outputs. Lock the doors. Protect the access, use strong authentication, and keep logs. Set and regret is not a strategy. Maintain an inventory, do regular check-ins, and verify everything that matters. And you know what? Here's the truth. We're all learning as we go. The technology is moving fast. The rules are being written as we go. But that doesn't mean we can't be thoughtful, careful, and proactive. We're at the bleeding edge of an AI implementation, and with that comes a lot of responsibility. The good news, we can have the robots and the trust. We can innovate safely. We can use these tools to do amazing things without compromising the privacy and dignity of the people we serve. So this week, I want you to do one thing, just one. Create your do not paste list, or turn on multi-factor authentication. That's what I think we should all be doing if we don't have it already. Or start your AI inventory. Pick one, do it, and then next week, pick another one. Because the future isn't about stopping the robots. It's about making sure they work for us safely, responsibly, and with the people that we serve always at the center. Thanks, Janine. I'll hand it back to you.
Thank you very much, Matt. Really appreciate you sharing the expertise with our audience and sharing the things we're thinking about at the department level to keep the robots in control. So appreciate that. I personally am really looking forward to the robots, Matt. The bigger they are, the better it'll be in my mind. Maybe not Terminator big, but you know, you get my gist.
Absolutely, yeah. But make sure you've got your MFA sorted if you're going to use those big models, Janine.
All right, I'll come see you.
Yeah, absolutely.
Thanks very much. We'll see you shortly again in Q&A. But for now, we're going to talk digital future. So we've gone from AI to cybersecurity, and now we want to talk a little bit about the year ahead and what we're hoping to focus on in our Tech Talk discussions going forward. By necessity, last year we did a lot of information sharing and we talked a lot about NACA implementation. That was what 2025 was all about, and I think it was totally appropriate. But while our aged care journey isn't over yet, we really are hoping to lift our gaze this year and turn our focus from not just looking at the immediate delivery priorities, but also looking at the future digital challenges that we as a sector face. We had a really good discussion on this exact topic at our last sector partners meeting a couple of weeks ago, and we wanted to bring some of that discussion and the perspectives of that audience to our broader Tech Talk audience. So let's talk mega trends. This is the new buzzword, and it's really about the new and emerging technologies that are hitting us as an industry. There's no surprise that lots of organisations are looking to innovate, to solve problems, to improve operations, to support compliance and quality care. And from our conversations, there's definitely some reoccurring themes that we're hearing from the sector. So the first one is new technologies, in particular AI. As Faye said, if you're not talking about it, you've probably been living under a rock. And the questions about how we can use this tool in a way that helps us, but is also safe, ethical, and appropriate for care settings. So we've talked a little bit about that already today, and we're hoping to also build that into our future agendas. Cybersecurity, a topic we discussed today as well, is another one that was front of mind for our audiences. This is especially relevant given the sensitive nature of the client and health information that we all work with. And then another big theme, which came up a little bit in the Faye and Andrew conversation, was workforce. So first, productivity pressures and the need to help our workforce to operate more efficiently, but also the need for stronger digital and data skills to support the day-to-day work. These aren't challenges that are unique to us who are working in aged care. As part of the aptly named Keeping Us Up at Night survey that KPMG recently released, Australian business leaders across industries identified their top concerns for 2026 and beyond. And for the first time, AI and new technologies ranked as the top concern for the year ahead. So it's not just us that's thinking about this, this is across industries. Digital transformation and cybersecurity also came close behind AI, while evolving regulatory landscapes and driving productivity also got a mention. While the survey wasn't aged care specific, as I said, it does strongly reflect what we've heard from you and the broader sector through our ongoing engagements. It's also worth noting that while technology was not the sole focus of the survey, digital related issues really did dominate the results. So digital is starting to become pervasive across all organisation management and operation. Business leaders say new technologies, including AI and issues around ethics and implementation, are their number one challenge over the coming 3 to 5 years. And these results point to both immediate and longer term impacts on how organisations build capability, how they go about managing risk and supporting a modern workforce. AI and the impact of new and disruptive technologies was also cited as a top societal issue. So it's not just affecting business, it's affecting all of us as customers and consumers and citizens. Business leaders expressed concerns about the future skills gap, which is something that we do talk a lot about at Tech Talk, particularly in relation to technology, data and health workforce. These were the top 3 social issues that were identified in that KPMG survey. When we talk to our sector partners about these mega trends, they reinforced some of the concerns really strongly. The sector want to see appropriate guidance on the ethical use of data and AI. There was uncertainty around data sovereignty and onshore hosting and processing requirements, highlighting the need for definitive compliance guidance. They also told us that innovation must support both future reform, but also the current generation through practical digital literacy and capability uplift. And that reform approaches should be inclusive and they really need to reduce the barriers rather than widening those capability gaps. They talked about the complexity across platforms, and that includes platforms like My Aged Care and GPMS, saying that they have a tendency to create confusion and administrative burden, and the importance of human-centred design in making them user-friendly and easy to navigate and intuitive. Andrew talked a bit about that in the development of Buddy as well, and it seems from what he was saying that part of the success of adoption was that the interface was so intuitive and easy to use for the frontline workers. In government, we are focusing on human-centred design, but it really is something that we need to hone in on even more, simplifying those end-to-end system pathways and ensuring that the guidance that we publish is aligned, really easy to consume and current. There was strong discussion also with sector partners about the demand for scalable automation and programmatic access like B2G APIs to reduce manual administration. So this is our system-to-system communications. There's frustration about ongoing system constraints and calculation issues like the client contributions and bulk submission updates, creating rework for software vendors and admin burden for providers, and a really clear need to make updates clearer and easier to apply. And there is also some value in centralised communication of known issues. That was something that we talked a bit about at sector partners, where we let people know in a central place when there is an issue with a particular system, and then the fixes and clear alignment between the program rules is communicated in a really central, easy to consume way. We covered a lot of ground, actually, in our sector partner discussion. It was a really great meeting, and a big thank you to our members for their guidance to the department and for the input they provided. We have taken it on board and we are thinking about how we feed it both into our system development and also into our future tech talks. And now we're interested to hear what the wider audience is also thinking. We've put to you guys some of the same questions we asked our sector partner group. which are really around, first of all, how are you faring post-NACA implementation? What are your remaining challenges? Do you have pain points you'd like us to focus on? Looking forward, how do you see your organisation's biggest priorities shaping up for 2026, particularly when it comes to all things digital? What are the questions, issues that are keeping you and your colleagues up at night? And what emerging data changes offer the greatest opportunities and challenges for us as a sector? We've put these questions into a survey that we'll be releasing, so you can share your thoughts, ideas, and challenges. You can see there's a QR code on screen. I know everybody doesn't love the QR code, so there's also a link via the chat, and we'll also make sure to include a link in our post-event email. I know many of you have done some really careful thinking inside your own organisations about these topics, and we're really keen to hear your insights and also to use those to plan for future Tech Talk sessions and to guide how we approach the department's broader digital transformation work. So encourage you to get involved in that survey. It won't take long. It's a 10-minute. Okay, just also while I've got you here, a quick reminder that our sector partner group is always open to interested volunteers. So this is our co-design group. We meet regularly. Our new meeting cadence is monthly, and you actually get into the nitty-gritty of how we go about co-designing our solutions across the digital transformation. Specifically, we've been focused to date on aged care. If your organisation is not a member, please reach out to us at the email you see on screen now. Again, there's a QR code for reference if that's your jam. And we'd be, really pleased for any other volunteers who'd like to get involved in those co-design activities. Okay, and that is that. Oh, hi, Faye.
Hey, I'm just popping up.
Welcome back.
Thank you. I'm here again. Thanks for having me back. On the previous slide, I just also wanted to make a quick note around if there are any providers out there who are yet having any problems making payments, getting payments to Services Australia, if they could also kind of reach out to us on the sector partner email address or the engagement email. We're happy to help make sure that, if you still haven't managed to get payments through to Services Australia, please reach out to us so that we can assist you. I think that was just a key call out I wanted to make sure that we put out there for everyone.
Yeah.
All right, where are we up to now?
All right, we're on to Q&A. So we have 33 minutes, so we're doing really well for time. And I'd like to invite our panel back. So Faye's already here. Welcome, Faye. Great to have you back. And if we can also have Matt and Andrew Dome added. Andrew, hi, welcome. And hopefully Matt's not too far away. We might just get rid of the slides, guys, so we can see our panelists. Well, that's great. We've got a Brady Bunch thing happening now. Perfect. Just a quick shout out. We have a bunch of subject matter experts behind the scenes who are also going to help us answer some of the questions. So that helps us get to the questions in the room rather than having to take them on notice. We may still have a couple that we need to take on notice, but we'll try and answer as many as we can. As always, we'll get through as many as we're able in the time remaining. But Faye, I feel like you had a question and you wanted to kick off.
No, it wasn't a question, but I feel like I was remiss in not acknowledging that Andrew and the team did actually win an award for Buddy. I believe it's the Asia Pacific Stevie Awards. So congratulations. I think being recognised for all the hard work. I just think it's always nice. A lot of hard work goes into these things, and I'm really big on making sure recognition is given for it. So congrats, Andrew.
Thanks, Faye.
Big round of applause from everyone. Yeah, let me do the reaction. We might get a few people. I don't even know how many people can do the reactions on our webinars.
I think everybody can.
Okay, well, there you go.
It's working for me. Hopefully it's working for others. Well done, Andrew. It's lovely to see not-for-profits out there leading the way with tech. Good on you.
Thank you.
Well,
great job for you and your team. Okay, so we're going to start off with a popular question from Tracy. And this question is there any intention or work being undertaken to have electronic notifications sent to providers when funding is assigned allocated? So Faye, we can put this question to you, or we do also have a phone a friend available in the back.
I think I need to phone a friend on that one.
Yeah,
Who's
great,
our phone
excellent. Friend, Matt, can I get you to jump in and give us the news on the answer to? So it's electronic notifications sent to providers when funding is assigned. You have to jump off. You can do what?
Yeah. I apologize. Is there any background noise that people hear as well? Yes, great question. So we are aware of this issue, and we're currently working on a solution to provide notifications in a range of circumstances requested by providers. So if you have any particular notification scenarios that you believe should be programmed into the system, please use us if they're not already included on our list. So that's the answer to that one. And thanks for the question.
Excellent. And just as a bit of a teaser, we are actually talking about those notification emails in the next sector partner meeting. So if you're keen, I would hurry and become a member. Okay. New referral code and submit a new entry notification, ACER, when they receive a funding upgrade. For example, support at home ongoing funding classification upgrade from minimum service offer, that's an MSO, to a full service offer, an FSO, for those across the acronyms. If so, what is the impact if they don't submit a new entry record? And this question's also from Tracy, and I might phone a friend again, Matt, if you don't mind.
Right here, Janine, thanks so much. Yes, so if there is an existing entry in place with Services Australia for the same classification type, then there's no need for a new entry notification to be submitted. So I hope that helps there.
Excellent. Thank you very much. I believe we had a question for Andrew, which was around the affordability of developing Buddy. So you did mention that you work for a not-for-profit. How did you go about developing Buddy within an affordable way, and what would you recommend for organisations that don't have a lot of tech budget available?
Yeah, look, it's a great question. And you can hear me okay? I'll just switch to my headphones. Yeah, good. Some drilling next door. So I've changed. Yeah, so we are a non-for-profit. We partnered up with Microsoft Technology Social Impact, TSI, which was known then, it's now Elevate. And we went through an incubation lab, and some funding came from them. What I would recommend is try and partner up with an organisation that wants to have a use case that they want to share, so they have some skin in the game, and then they can leverage off that as well, or you can leverage off that as well. And there's plenty of them. Remember, AI, whilst it's been around for decades, it's really only been in the sort of public kind of thought process for the last few years. So there are a lot of small organizations that want to make a name for themselves. Try and find some of those, get them to have some skin in the game, and really partner up with a solution. So you can share the stage with them and talk about the great outcome if you create one. So that's what I would say. Leverage those partnerships. Find someone like a Microsoft or some other player out there that really wants to develop, co-develop, and then bring it to production with you.
That's a great suggestion. Really like that. And Faye, was there anything you wanted to add to that one?
I think that's wise words, especially if you've got a limited funding budget in that sense, where you can partner up and leverage. I find it really hard when everyone needs to do it from the ground up on their own. And that means you need to bring all the expertise and the costs and the learnings and the testing and learning and the iterations. So definitely look for, where it's been done before. Architecturally decide what ecosystem you might be, betting on, because once you've gone into that ecosystem, it's very hard to pull back out. So, make it a tool or an ecosystem that you've decided is going to be a core strength or capability of your department or your company. And then look to partner where you can. So hopefully that helps. And Matt can add the CISO bit and go, make sure you do it safe and
I
secure.
was just about to handball to Matt, because I think there's a similar question about some of the security things you were talking about, including the multi-factor authentication. For our small organizations who don't have a lot of tech staff, maybe have none, how do you recommend they go about exploring cybersecurity in a way that gets a good outcome for them?
Yeah, that's a really good question, Janine. I think from a security point, when we're looking at AI in particular, and I might caveat that around AI, just be mindful about what you feed in there. That's probably the very first thing that I would say. If you're using a public model, don't put any confidential information in there. If you're using an enterprise model, check your LLM, make sure it's stored in Australia, especially if you're using government data. MFA can be really, really cheap to implement, especially for those smaller organizations. There are free apps out there and services that you can use for multi-factor authentication. And I'd recommend it across the board, even in your personal life. MFA is probably one of the most powerful things that you can implement for security to protect your personal life as well as your organization. So for example, if you're logging into ChatGPT, just make sure that you activate MFA. Same with Claude. There's a lot of information that you're putting in there on a personal basis. It will learn who you are and what you want or what your interests are. And I don't know about you, but I don't want my information out there being used in a way that I can't access and pull back myself. So those are some important considerations. But I suppose to distill that down, be careful what you're putting in there. Make sure that you're using the right model for the right task with the right information, and activate MFA. Those are cheap and easy things to do that anyone can do in their personal life or in their corporate situation.
Great.
And Matt, just because we went down that path and it can't help but, and if you're a CIO who's looking after it and the network, I think one of the things is that they kind of block the ability for internal staff to take things outside the network and put it onto public AI platforms. What would you say about that? Because I think that's a number one, multi-factor authentication, but also that.
Yeah, absolutely. You're entirely right. So, I'd recommend policies, but the very easiest thing that you can do is that no paste list. Personally putting out there into these large language models. A lot is already there, and those large language models are using that information. So create that do not paste list. And like I said earlier, make it like it's your emergency evacuation plan. Stick it on all the walls. Make sure everyone knows about it. It's not always about technical controls, because not all of us have the money or the know-how to be able to do that in these organizations. But it's about getting the culture right for the use of AI with security.
Yeah, Matt, I really liked the tip you gave. If you're not happy to put it on a public board, if I'm not going to put it on a poster on a telephone pole at the supermarket, then I don't want to put it in AI. That's a really good logical check for people who aren't terribly tech savvy but want to be safe and secure online. Yeah, that's awesome. Thank you. Excellent. Okay, moving on. We've got a question from Amanda. And I might start by putting this one to Faye. So when is it appropriate to use AI? I would be interested to know the usage AI by the process. As it appears to be double standards to advise us how to use AI when it's being used behind the curtain and having dramatic impacts on patient care. So Faye, are you able to sort of respond to that? I know we can take this one on notice as well, because I know there's a policy element here, but if you want to get us started.
I might start by saying firstly that no AI has been used in any assessment automation in the New Aged Care Act. We don't use AI at all. We do have some business rules that are aligned to the policy that for the New Aged Care Act that looks at the needs information that's been provided and their eligibility and entitlement, and that has been digitised and applied for assessors. But in no way are we using any AI or in that sense. I think sometimes we might misinterpret the word algorithm. There was a policy algorithm that was defined, to decide how the policy should be created, but we then took that and digitized that in a set of business rules. So no AI in aged care at this stage, and to be quite honest, I think no automated decisioning either. So a human, we talk about having the human in the loop at all times, and it shows the results of what was the business rules. Really, the only time it changes is if their needs change. So hopefully that helps. Just a start. And then if you want more information around how the algorithm was created from a policy perspective, we can take that one on notice and come back. But I do know that was actually a long period of time there too, and I think they worked with a university to develop all that over a period of time and consultation. So
we might come back into that. So let us know, Amanda. But Faye, thank you for taking that question. I think it is a common fear that people have. So it's really, I guess, important to understand that difference between what is AI in action, making independent recommendations, and what is an algorithm that is coded around business rules. Sorry, you go.
No, that's fine. I agree. And so we talk about AI and we're going to use it, and we might use it internally for some really simple generative things like helping us summarize something that we might be doing internally in our own job. Or, we're showcasing like Andrew in Uniting, how they've used AI to assist their staff. But when it comes to aged care, the legislation kind of prohibits AI in the use of the actual policy implementation that we've created and the automated decisioning. So, and I would encourage everyone, and that was part of my, think twice before you use AI. You really need to stop and look at the regulatory environment that you're in and say, the use case I'm using, am I even allowed to use it? And different states and territories, because we're federal, and then the different states and territories have their own requirements and approach as well. So it's not very uniform. We are definitely in an innovation and experimentation phase of an emerging technology, and that's why we encourage you guys to take care and start small. Start with a safe use case and really test and learn and evolve it. But it can be a very powerful tool, and it's something to augment. It doesn't into the tasks that you're already doing.
One of the sort of mantras in the department that we use around AI internally with our staff is proceeding at the speed of trust. And trust is slow to earn, right? So so that gives you a bit of sense of how fast we're going. We're experimenting and iterating and experimenting and iterating, small baby steps in the beginning. Yeah, awesome. Thank you so much, Faye. And thanks for the question, Amanda. Really, really good topic to unpick a little bit more. Okay, next question is for Andrew. Does Buddy have potential outside of aged care, for example, the disability sector?
Yeah, it absolutely does. In fact, I've actually presented Buddy to people outside our aged care sector, community services, a whole bunch of other organisations. I won't name them, just in case they're on the call. But the reason being is Buddy is what we call a digital front door, right? So it's an application. You would have seen it in the diagram. It's an app. People click on a tile, and then it either creates content or it will surface content from large language model, whatever the data source is. So that doesn't have to be specific to the aged care sector at all. And in fact, if you think about the transcription service, that creation of a care note, which we're using it for now, people have to do notes everywhere, right? They have to do progress notes outside of our sector. Anywhere where you need to do a voice to text type service is where it can be used. So absolutely, lots of people outside of our sector have shown a real interest in it. They want to know how we did it, obviously what we invested to get to where we got to today, what the use cases are, and what we've got planned for the future as well. So absolutely, it's not limited to our sector by any means.
Yeah, and I love one of the things that came out of the megatrends content was this idea of scalability. And it's this idea that if one of us builds something that's really great, how do we reuse it across other industries and across other care scenarios that potentially saves us a little bit less of the startup leg work. Yeah, great. Okay, we have a couple of questions that are around Services Australia, and we have had our Services Australia folks answer some of those in the background. So Matt, I might just, not Matt Newman, Matt Key, in the these popular Services Australia questions just so we can get those ones answered in the room. So the first one, Matt, is from Nicole, and it's when a claim is ready for review, meaning it's completed and paid, can we have a reason column why an item hasn't been paid? Currently, we're having to reclaim these items that have not been paid, and they are processed and paid, have not been paid, and then they are processed and paid. So they're initially not paid, then they're processed and paid. It's not ideal, she says, for a better system. So she's hoping for that new column to be added. Matt, what have Services Australia said for that one?
Sure. Thanks, Janine. Thanks, Nicole, for the question. So that they've told us that Services Australia have heard various feedback on the current view of payment statements in the aged care provider portal. And this does include the display of budget balances at the line item level to help with reconciliation of payment or of non-payment. So Services Australia can take this further feedback on board for consideration of improvements. So there'll be more to follow on that one.
Great. Next question related to Services Australia, we'll just get through a few in a row, is from Adam. You referenced a support at home budget reset in one of the earlier slides. What was the budget reset referring to?
Yeah, so that was referring to budget reset acknowledges dates in which new quarters for the support at home ongoing budget occur.
Great. Thank you. And then last one for you, Matt, from Jennifer. Recent changes to document requirements within PROTA were applied without provider notification. In practice, many of these documents are not available at the point of permanent admission. What is Services Australia intended process for notifying providers of PROTA requirement changes? And how should providers manage compliance where documents are unavailable? Can you help us with that one, Matt, before we move on?
Great. Yes. So Services Australia are saying that they aim to provide regular updates in respect to changes to the aged care provider portal functionality. And they're happy to take any specific examples to follow up the availability of relevant communications to better support the network. So perhaps if Jennifer's happy to reach out to our team online, and we're happy to connect them, and if she has any specifics that we can follow up.
Thanks very much, Matt. Okay, just having a look. Oh, we had a question for Andrew. Can you tell us about the award Buddy received?
Oh, okay. Yeah. So just quickly referring to what Faye mentioned before. So that was the Asia Pacific Stevie Awards. The Stevie Awards are a global award system offered to organizations and professionals. We won the award for technology, innovation and technology development for non-for-profits. So it was open to anyone in APAC region, and they it was our gold, silver and bronze, and we got, which is the highest award. Because they're the ones that do the hard yards and designed, built, and deployed this tool out to everyone. So yeah, it's a pretty prestigious award, and pretty chuffed that we managed to take it away.
Nice one. Well done. Okay. Faye, someone was mentioning that Uniting Care would have used retained earnings to invest in technology. So obviously when you've got some scale and capability in-house, it does help you implement these types of things. They were wondering what can the department do to ensure more collaboration in tech development and implementation? And that question's from Jane.
Hey, Jane. I think, as you can see with these tech talks and sector partner community, we are really driving a co-design approach. If there are any specific questions, we try and answer them and arm people with information. Specifically in AI, the Department of Industries has also put out an AI plan for the nation, and they're definitely putting a whole lot of resources and information there. There are a lot of software ecosystem. To Andrew's, we definitely innovation credits and things like that. So, or you can just partner up with other people in the sector. I find aged care the most collaborative sector that I've seen, where even though, you know, they're in competition with each other in some sense, the fact that we're here to help the human and the care on the other side, and we want to look after our workforce while we do it. I think that there's a lot of people who are willing to share IP and their value proposition. So that's where the sector partner community does come in really handy, where we do talk about lower level tech items. And I have heard of many a situation where different people have connected offline to come up with some really cool things. So hopefully that helps.
Takes an army.
It does. Takes a village. Is that the...
For sure, for sure. Sure. The other thing we're hoping to talk about later in the year is the data and digital strategy that the department has developed as well, and get the responsible people back to talk about that and how the department's encouraging innovation across the sectors that we work with. So we'll make sure and get that on a future agenda item. Okay, Matt Newman, this one's for you. We've got a question around, well, actually, first a comment. Great cybersecurity advice. Thank you. So thank you, Matt. Appreciate that. The person was saying it's worrisome that these things aren't already common knowledge and commonplace even before we started using AI. It's a comment, but do you want to add anything to that thought, Matt?
Yeah, I might, Janine, because I know that we're all on different phases of this journey of cybersecurity. Especially when we start to talk about cybersecurity of AI, it's same but different. And so I took the approach of going back to basics on how we secure AI. So my comments haven't been a reflection of what the sector is looking like security-wise. I know that there are some organisations that are well and truly further advanced than the topics that I spoke about, and some that are probably a little bit behind what I was talking about. So what I wanted to do was set a good baseline for everyone. If you do those things in your personal and professional lives, your security will increase substantially when it comes to any kind of service. And I suppose I might take a second, Janine, to just talk about security of an enterprise, because artificial intelligence is just another piece of technology. Yes, it's far more convenient than answering your own emails and scheduling yourself in your calendar, but it introduces some extra risks. We talked about data going into AI. I don't want to thrash that any further, but what I might talk about is the Essential 8. So the Essential 8 is a framework developed by ASD, the Australian Signals Directorate. It's full of 8 main principles that you can implement in your personal life and in your enterprise to uplift your security according to different maturity levels. It's not super technical. You can do it at home with only a little bit of experience, but I'd recommend that you get an expert to help you do it really well. So there's lots of information as well on cyber.gov.au on how to secure AI in particular and how to use it appropriately in a secure way. So if you want to know any more information about that, jump on that website, cyber.gov.au.
And
Matt, and jump in, Faye.
Thank you. I was going to say, like you said, this was already there. AI, and this is what I said earlier, AI is just amplifying it, because we seem to be putting, you know, the keys in the hands of many people now. So digital is no longer just ICT, like who's doing digital. This is where people are actually having in the business have access to using an AI to help them automate something. And so now their digital baseline needs to get to a minimum that maybe they didn't have before. And I think that's a big key, is that the digital workforce is everyone's business now.
Absolutely.
That concept of amplification is really important, I think, and the metaphor you used, Faye, of getting behind the wheel of a sports car, very different from when I learned to drive in my Datsun 200B. Like I'm not going too far wrong in that, but put me behind a Lamborghini, I think I would have been in trouble. So yeah, it's the amplification of the risk that becomes really prevalent, and the increased access so that everybody's using those tools. But it's definitely really interesting to talk about. Faye, you've highlighted the importance of staff understanding consent and data handling, transparency and privacy when using AI. Is the department working toward any national guidance or minimum standards for these areas? I guess it seems to be that providers are concerned about being left to interpret this stuff and how to apply it and implement it locally So what kind of guidance is available, and is the department intending to provide any?
So yes and no. So we'll continue to provide AI information, and we'll start to work with our policy folk about, in specific areas, what the legislation means. So that's where it's localized. From a overall perspective, as I've mentioned, the Department of Industries is the department responsible of putting AI out in there for the nation. They have pulled together an AI plan already. It's out there. You can go on their website. They've got lots of resources available. So that's kind of your top-down approach. But then that's not going to give you all the answers that you need, say specifically in your aged care line of business, or in any other sort of line of sector. So GPs are now using an AI scribe. Well, we'll all need to start considering, and I mean the royal we, so as the department starts to look at it and go, well, is the AI scribes hosting the care notes offshore? Do we as a department need to be more prescriptive around policy settings or regulatory settings that says, no, we want to keep them, that data onshore? So often the first things I do when I'm talking to anyone, whether it's inside the department or external, I just like to keep things sovereign. So make sure as much as possible we're hosting everything in Australia, and Matt alluded to that in the AI. And make sure you check where your the AI algorithms are and the models. Make sure you understand, well, the model might be here, but it might take the data offshore for periods of time to get processed. So really try and ask those really basic questions around sovereignty. Then I would apply your privacy lens on it. So, are you looking at data that belongs to, a citizen, like privacy impact assessment of the data that you want to use? Where possible, keep that within your department. As Andrew has looked at it, he had some great foundations already. So, if someone didn't have permission to look at that client's data before, the AI on top is not going to let them access it either. So really have your role-based authentication around what data people are allowed to look at. And then, of course, consent. So sometimes the legislation in government, and I can speak from our perspective, we collect data that says we can only use that for the purpose that we collected it for. That's just giving our personal, government lens, right? So my health record is an example of where we've got data. There's more legislation to change that, where we can do more openly. But in your own organisations, just maybe when you're signing up a client, make sure you've got a consent on how you plan to use the data internally. So they're just kind of privacy, sovereignty, privacy and consent are kind of the first three things I look at. And of course, and security is all in, a foundation underneath all of that. So hopefully that helped. Lots of sources out there that you can get on and have a look. Worst case scenario, you can ask ChatGPT, it will give you a list of them. No, I'm only joking.
We'll include some of the government resources in the post of our email as well, so that'll save you going to ChatGPT too.
But I did also notice there was a question in the chat that said, often when they've used AI like a ChatGPT, it gives them things that are like 10 years old, and that's correct, because it is going to get whatever information it can. Sometimes it will hallucinate and make up an answer as well. So that's why we talk about having the human in the loop, that, you need to use it as a tool, as a research tool, right? And like if you, a student who's gone and research, you need to fact check, like the information you get. And so, or get smarter with the prompt. Say, I only want references from the last, 12 months that can be cited. And so that's where you have to get smarter with the question. So I just thought I'd mention that as well. Knowing that there was a question.
Yeah. And Matt also mentioned that under the umbrella of cybersecurity, that the importance of having that kind of logical review and making sure that what you're getting back actually stands up to scrutiny. So it's good to know our human brains are still essential.
Yeah, we've got to verify everything. There has to be a human in all parts of this. This data that we're dealing with and the importance of the work that we're all doing in this sector, it just necessitates a human being in the loop.
Great. Well, look, we've got a couple more questions, but we're not going to get to them before we close. So, Matt, I'll put you on notice. We've got a question about emerging security issues. Can you give us some intel on what to watch out for and plan for? So we might take that question on notice and bring it back to a future meeting. I had a really quick question from Liz as well on the Australia portal. I think it was similar to the earlier question, but it's around the status of submitted claims and the fact that the Services Australia portal used to show processing and have advice from Services Australia that there's no current change scheduled to address this. However, they're happy to take the feedback so they will take that on board, and if that gets addressed in the future, we'll come back and let you know. Thanks very much for the suggestion, Liz, much appreciated. And a big thank you to our presenters today, Matt. Great to have you here. Really good to talk cybersecurity and robots. Andrew, excellent to hear your experience in the non-profit in experimenting with these new technologies. Congratulations on your work. Thank you very much for the information you share in these events, and we're answering our Q&A. As always, we will be posting the recording of this event. We'll receive a post-event email with lots and lots of links in it. There's also QR codes on screen if you want to provide any suggestions or email about anything after that. We'll be distributing that we already spoke about. Hey, we're 1 minute over. I'm so sorry. Please take us out with some words.
Thank you. And yes, thank you everyone for coming. Our next Tech Talk will be Wednesday, the 18th of March. If there are any topics that you'd like us to cover, please, put it in our post-survey event for us and let us know. And we're hoping that you're finding the discussion very worthwhile, and see you next time. Until then, goodbye.
Thanks, everybody.